Hey everybody, I made it so far. Sorry I didn't do a video yesterday. I actually had to sleep and recover. That kind of took over the things on the importance scale for me and my body. I got the infusion, and I got what I call the infusion confusion. That's when your body doesn't know what it just got pumped into itself, and it's trying to figure out what to do. So that's an interesting feeling. Um, the infusion went great. Um, so far, my body's accepted it, thus far. So everything's looking good. I'm monitored heavily um, through blood work and constant visual inspections and so on and so forth. So if there is something that pops up, they'll probably know before I do. That's about it. So what did that feel like? It was weird. It was really weird. I had a whole bunch of people in the room, and it was really only a two-person show, the patient and the person running the infusion. But I had a whole pile of people in the room because, like I said, this is the first in human trial. So I had the three wonderful ladies who actually grew and cooked and multiplied the cells and stuff that they infused into me. So I got to meet them, which that was really cool. That was unique. Those cells and everything have been their baby for about a month of them, programming them and then growing them and making sure that they're healthy and at optimal stages and that they are replicating as they should be. So I'm sure that wasn't easy at all. So it was awesome. I got to meet them. There's a lot of other nurses from different floors that are going to be doing this, that came to watch the actual infusion process being done. So I had a bunch of them. There was like eight or nine different of those folks here that were just here to observe the process of the infusion, because they're going to be doing it, like I said, on their floors here very shortly, hopefully, as long as this goes well. The physician that's in charge and the team was here to observe. So I had the director and then the rest of the team, my regular physician, and like all the nurses. It was like a really big, I hate to say it, a dog and pony show, but it wasn't like a dog and pony show is like, this is annoying. Like, this was a dog and pony show. Like, wow, we're actually going to do this. All that work, all that planning, all the failures and successes, and all of the red tape and everything they had to go through to make this product actually eligible to be put into a human body. It's all coming to fruition in one moment, and they were here to watch it. So it was really weird. It was really weird on that sense, because I'm like, wow, I hope I don't mess up. But in reality, I didn't really have anything to do. I just had to, get this infusion. And, on that note, too, it was like, wow, I hope nothing goes wrong, because, these people, you could tell they worked so hard. They worked so hard. They put so much of their life. And I'm sure, what does this mean right now? These folks can take a deep breath, because I'm sure that there were so many hours worked on this, so many extra hours, so many meals missed with their families, vacations, possibly birthdays. Something happened, they had to go back to the lab or something. I'm sure that there was time away from their families that was spent and that's invested into this. And, I'm sure this meant a lot to see that, see their hard work and dedication, come to life, or give life, basically. So, yeah, I got to meet all those guys. I thanked them. I was like, wow, this is really cool and impressive. And, you're gonna save my life and all that stuff, you know. So I hope they left this, you know, with their chin up in the air, because they truly deserve it. So yeah, what was the actual infusion like? Well, I can tell you one thing: they load you up with pre-meds like crazy. So, I mean, they gave me like 50 milligrams of IV Benadryl, which will knock anybody out. Like, you'll fall asleep with 50 milligrams, especially when it's IV Benadryl, which surprised the living daylights out of me, because they normally don't do that. But yeah, I had that. I had Advil, aspirin, bunch of anti-inflammatories, couple steroid injections. So I was loaded to bear with anti-everything pre-meds. Like, so it was that was crazy. And then the actual injection, or the infusion injection itself, I didn't really feel at all. It was a little bit after that I felt like my blood was heavy. Like, I had real thick blood. I was very sluggish. I was like, oh, I could tell like something, you know, other than it tasting kind of funky. I remember it tasting kind of funky, but as it was happening, nothing. It was just like getting an IV with IV fluids. So that part worked. But it's afterwards, after it sets in and stuff, that, you know, you start noticing things, little hints here and there that something was put in your body that, you know, is not normal. And for me, it just transitioned into like my blood feeling real heavy. Like, I needed like an oil change, just like real thick, you know. And I'm just like, everything takes a little bit more effort to do. That's all it really feels like as of now. And that's what I've just been sleeping. Honest to God, I've just been sleeping the whole time. I just woke up here a little bit ago and actually responded to some text messages because I set my phone down and had it on Do Not Disturb, and I was out. And then when I am awake, it's like in very odd hours. I don't want to bother, you know, sending a text message or calling somebody, you know, like 3 in the morning or 2 in the morning, you know. So I decided, I was like, hey, I'm awake and it's a decent hour. I'm gonna do these things here real quick. So yeah, I'm doing really good. For now, I'm hoping that this trend continues for the time that I have to be observed. And I have to ask them what that is, because I have no idea from this point what happens now. I don't think that they really planned on saying much, because they didn't know like how you would react to it, kind of thing. So, you know, now that I know that I'm doing pretty decent, I haven't had any sort of reaction whatsoever yet. I don't know how long or wide that window of a reaction or a rejection would be. So I'm gonna have to ask them. Those are 2 good questions to ask, and I'll let everybody know once I know that, I guess. So yeah, doing good. Looking forward to moving forward with this, and I'm excited. This is pretty neat. I don't really feel it like killing cancer cells. So if anybody's wondering that, no, I don't feel it like going through doing anything. I could feel it going through my body, because like I said, it's like that heaviness, and I could tell where it's been, you know, kind of where the cells have been. At least I could feel that. That was really bizarre. It was a really weird feeling, but other than it actually combating cancer cells, I have no clue. I don't feel it. At least I don't know I do. I might, but I just don't know what that feels like yet. So, yeah. That's all I got. I'll do another video here. I'm just happy I was awake to do one because I've been sleeping for a while. Probably gonna go back to sleep real soon because I am just really tired. It makes me sleepy. I don't know. Call it weird or whatever, but okay, everyone. Take it easy. God bless you, and keep me in your prayers. I'll keep you updated as soon as I know something. So, talk to y'all later. Bye.